Hello friends, let's see some mixed topic MCQ, mixed topic questions, their final answers. Okay, so we have this vertebra and there is pointing peripheral and nucleus. So what is this? Periphery, this is annulus fibrosis, and it is derived from sclerotum. What is B? Centrally, it is nucleus pulposus. It is derived from notochord. This is CT scan of abdomen is showing hydatid cyst. Why? Because it is hypodense lesions. Why hypodense? Hyperdense is white, just like bone, and hypo is some darkish. So this is a hypodense lesion, and this is right side of abdomen, this is left side. So right, it is inside liver. Okay, and here septa are seen, that is internal separation is seen. So this is hydatid cyst. And one more sign is when it ruptures, it shows water lily sign, maybe in X-ray and CT scan. Next one, X-ray hand, and this is the diagrammatic representation. Okay, this is Neet fracture. This is base of first metacarpal bone is fractured. Okay, and it is intra-articular fracture. And what is the mechanism? Is force abduction. Force abduction is causing this intra-articular fracture, known as Neet's fracture. Now, what is Rolando fracture? This is comminuted. At least 3 bone parts are seen, and it is of worst prognosis. So Rolando is a famous footballer we can remember, and complex. He can kick complex shot. So something is complex, comminuted. Okay. What is this? This is a test tube showing some storming fermentation of litmus milk. This is in microbiology, and whenever I see this stormy fermentation, I can say stormy performance. Okay, so clapping, stormy performance. Whenever someone is performing on stage, we applaud by clapping. And so this is the mnemonic. Okay, so stormy performance. Then we have the bacteria Clostridium perfringens. Okay, this produces acid that can coagulate milk, and clotted milk is disrupted by production of gas. That's why this is this look like stormy fermentation. Storm. Okay, so from performance we remember perfringens. Okay, next this image is phrinoderma. This is taut skin on extensor surface of elbow and on knee. So age is 5 to 15 year, male and female both are same in this condition. So deficiency of, why this happens? Deficiency of vitamin A, B, C, E and essential fatty acids. So phrinoderma is keratotic follicular papules with perifollicular hyperkeratosis. So hyperkeratosis is here. Okay, some other conditions associated with this phrinoderma is malnutrition, protein energy malnutrition. liver cirrhosis, anorexia nervosa, alcohol abuse, and post-bariatric surgery. Next point. So this condition, this 4 or 5 year child is having this precocious puberty. This is and MRI is showing in the same patient pedunculated hypothalamic hematoma. This is non-neoplastic lesions, and the treatment is gonadotropin releasing hormone, gonadotropin releasing agonist. Okay, so this is the condition: precocious puberty, premature activation of hypothalamus pituitary gonad axis, and early bone maturation is seen in this patient, so height will be less. In bacteriology, let's see microbiology. This is Aspergillus flavus, and another hand this is Aspergillus fumigatus. So flavus, this is the mnemonic. Flavus is the flavor. We can think about flavor. Flavor is something about tasty. Okay, here is the laddu. Okay, so when we take this laddu, we can have aflatoxins. So hepatitis and hepatocellular carcinoma can happen. So मैं लड्डू यहाँ क्यों दिखा रहा हूँ? So we take laddu, and our GIT system have exposure of these toxins, and liver is attached to our GIT system, so hepatitis and hepatocellular carcinoma can happen. Okay, now here is the fumigatus, Aspergillus fumigatus. So friend, this is very confusing between flavus and fumigatus. So मैं यहाँ अगरबत्ती शो कर रहा हूँ. So fume, we can inhale this fume, and such fume gets stuck to our lung system, pulmonary. So pulmonary manifestation is in the fumigatus, this fungi fumigatus. So Aspergillus fumigatus is associated with invasive fungal infection in immunocompromised patient or something transplanted patient. So pulmonary infection, lung infection in immunocompromised patient, this is Aspergillus fumigatus. Okay, now in the slide, flavus has globular vesicles. So all around this main, I think conidia बोलते हैं, this is globular. All around is this vesicle is seen laddu. So vesicles, globules, goal. So that's why I made laddu, flavus. Okay, now fumigatus has conical vesicles, so like this. Okay, here is the pictorial representation of flavus and fumigatus. Here is cone, and here is globular vesicle. Bronchopulmonary infection again in Aspergillus fumigatus. Next one, what is this? This condition is Morgagni cataract. Here we see hypermature. What is this? Hypermature cataract, and nucleus is brownish here. And cortex is liquefied. Milky. Now next photo, it is a rotting reflex, showing the rotting reflex. It appears at 32 weeks and disappear at 3 to 4 months. Next pictorial representation is the larva of Anopheles, Culex and Aedes. Anopheles larva is parallel on the water surface. Culex कुली लटकता है ट्रेन में, सो यह एंगल पे लटका हुआ है. सो दिस क्यूलेक्स इज एट inclination, some angle inclination. Aedes is also with some inclination at angle. So thank you friends, like and subscribe my channel.